Hi everyone, thanks for listening to my presentations. Today I'll be talking about a very sensitive issue, that is erectile dysfunction. This is a serious problem affecting many males. Um, Men are actually ashamed to tell many people, even to confide in their physicians will take a lot of courage, and I don't blame them for that. Because they don't want anybody to know that that is going on in their lives. I don't blame them. But I'm assuring you that after listening to my presentation today, because I'll be going into all possible causes of erectile dysfunction, and by the time I'll be done with the next presentation, which will be the treatment, you may have less questions to ask, but actually consult your physician if my pieces of advice will not suffice. Um, it has caused a lot of disharmony in so many relationships, so many families that I'm aware of. Uh, it could lead to depression. And you know what depression is all about? Depression could, get worse and lead to suicide. But I will try my best to address this sensitive topic with dignity, and I will tell you all that you need to know. Wives should please, or girlfriends, or common law female partners, or even male partners to male partners, now please pay attention, listen on behalf of your partner so that you can trace the cause or causes. And by the time you listen to the treatment, you can jointly take decision to see appropriate healthcare provider to help out. And because the children might be listening, of course, I will use terms that will be bearable, putting this at the back of my mind that children might be listening. And with that in mind, let's go. Okay, erectile dysfunction could be defined as an ability to gain erection, or to those who could even gain erection, they may not be able to maintain it. And to some that could maintain it, they will only maintain it for a short period of time, and they will have what is called early or premature. You understand what the next word will be. It could be summarized as inability to satisfy the partner. Well, that could mean many things depending on what the partner will call satisfaction. So it depends on both, either the male partner or the female partner saying that he or she had satisfaction with the interaction that they had. So it's a serious problem that the affected male will be feeling not capable of gaining erection, or not being able to maintain it, or having early or premature, you understand? And just sum it together, there's lack of satisfaction as per meeting the demands or the expectation of oneself and of the partner. Causes. It could be psychogenic. When it is psychogenic, that means it is acute in nature. The way we will know as physicians that the cause of this erectile dysfunction is psychogenic is that it will be acute in nature. So the patient will come that, oh, this has never happened to me before. It just happened, last week or 1 week ago or 1 month ago, and then that has been the case. And another points to know that this is psychogenic is that the individual will confide in us that no, when I was interacting with someone else, I was fine, but not with my wife, my girlfriend, or my common law partner, and so on. So there will be the likelihood of this problem happening only when it is about one particular partner, and the individual will be able or will be happy and will meet up when it is someone else. So when we pick that it is acute or sudden, could could be okay with someone else, but not with someone else, or not in a certain situation. Okay, when we pick that, we know this is psychogenic. I will go into details of psychogenic erectile dysfunction later on. It could be organic, and in organic state, that will be gradual in onset. It's not going to be sudden like psychogenic. So it's going to be from being able to then getting reduced with time, or the situation is getting worse with time. And even some of the patient may be able to identify cause or causes. For example, somebody just comes and say, oh, I could notice is when I started taking some pills for my high blood pressure. Okay, so there's organic. Mixed. Mixed is a bit of both, a bit of psychogenic and organic. Okay, back to psychogenic. So if the cause is psychogenic, it has to do with the mind. In that case, it will be acute in nature. And the situations that could happen would be something like performance anxiety. I don't have to go into details of that. You understand what performance anxiety is. Or it could be as a result of traumatic past experiences. No, the man remembers what has happened in the past, and then the interest is gone right now. Or it could be as a result of relationship problems. For example, husband thinking that the wife is cheating, or it is actually true, then the mind would not be there. Or it's as a result of family disharmony. There's quarrel in the family, fighting over whatever. Or the man is actually depressed, like the mood is down, sleeping all the time, um, feeling guilty, psychomotor retardation, no longer having energy, no interest in matters that always of interest to him before now, probably having suicidal thoughts somewhere. So the man will know that this is not the high point in his life, is down, is depressed. Maybe there's something happening in his life, like businessman, that business is not moving, or just lost job, and so on like that. And another cause of psychogenic erectile dysfunction could be stress. For example, honeymoon impotency. Like, it's acute, right? You've been struggling, running up and down, distress, getting everything in order, pleasing your girls, dancing, and then you get to together and there's a problem. So don't worry. If that is the story, you get out of it. Organic. Organic causes are a lot, and I will take time not to leave any out. So it could be neurological problem, like spinal cord injuries, leading to paralysis. There's no need to bother about that because the man will know that that has happened. You can't not have paralysis without knowing. Okay? So we'll not waste time about that. It could be brain injuries, could be Parkinson's disease, diagnosed or obvious to you, could be Alzheimer's disease, could be multiple sclerosis, or even stroke. All these could have been diagnosed in the affected man. But the reason why I'm saying this now is some men could have this diagnosis but not yet disclosed to their partners. Maybe because they've taken treatment, but they're not completely getting out of it, and the partner doesn't even know the diagnosis that the male partner had in the past. So listening to this will stir up your curiosity to find out from him. It could be previous surgery in his life. Maybe this is a man who had prostatectomy in the past or surgery involving the perineum. If that has happened in the past and now is now having erectile dysfunction, that could be traced to their past surgery. Still on organic causes, now drugs or medications. Medications are those that we prescribe, and drugs are street drugs, right? So someone is hypertensive and is on antihypertensives, particularly beta blockers. It could worsen or create or lead to erectile dysfunction. If that is the case, if your partner is having high blood pressure and is on beta blocker, atenolol, metoprolol, and the rest, find out. That could be changed to calcium channel blocker. Calcium channel blockers will be fine. Will be controlling the blood pressure and at the same time helping out as per erectile dysfunction. Could be antidepressants. A lot of them will give erectile dysfunction, but trazodone will actually help. So the person is having depression and taking trazodone, there will be no erectile dysfunction as a result of that. So the depression is taken care of and the man is being assisted as per erectile dysfunction. Antipsychotics, of course, will not be good for male when it comes to erectile dysfunction. Antiandrogens, flutamine, spironolactone. There are a lot of other medications to use when we are faced with that, like spironolactone, potassium sparing. You can easily discuss with the doctor and change to another diuretic. If you are given another diuretic that is going to lower the level of potassium, you could be given potassium exogenously. So K, K-DOR, and the rest. Recreational drugs. Guys, that will not help you, okay? I have produced a lot of videos, PowerPoint presentations on recreational drugs. Check my channel for them. Alcohol, I will still go back to that later on. When you are boozing for a long period of time, the level of testosterone will drop and you come down with erectile dysfunction. Like I've said, beta blockers will make it worse, particularly for people that have high blood pressure and are taking treatment. H2 blockers for those who have peptic ulcer disease, low fibrates, dealing with lipid. Sedatives, of course. Sedatives will knock you off to sleep, and you understand what I meant. Heroin is part of street drugs or recreational drugs, digoxin for arrhythmia or heart failure, Tazides, as diuretics, and of course muscle relaxants and antispasmodics. They will all lead to erectile dysfunction. So when you are on any of these medication, discuss with your doctor. By the time we get to treatment, we'll be able to deal with that better. Still on organic causes. Cancer treatment, for example, radiotherapy, if the man has been diagnosed with prostatic carcinoma, could be the cause of the erectile dysfunction that is facing today. Anatomical problems. I will not mention that organ, you know what I'm talking about. Okay, Peyronie's disease, cavernous fibrosis, and fracture of that male organ will all be the anatomical problems that could present with ED. Vascular problems like diabetes mellitus. As a matter of fact, so many men with type 2 diabetes mellitus will actually present with complications before being diagnosed. And one of those likely complications to present with is impotency. So, without wasting your time going into details of that, you can check my channel for all the presentations on diabetes mellitus, and you get this fast. Hypertension, I've just mentioned it. The hypertension itself could lead to ED, that is erectile dysfunction, or the medications you are taking to treat it. Hyperlipidemia, smoking, yeah, guys, smoking, and you want to get out of this problem, you have to stop. By the time we get to treatment, we'll be able to talk about that better. Peripheral vascular disease, we'll talk about that more while talking about treatment. Still on causes of erectile dysfunction is hormones. Hormonal factors could be in form of hypothyroidism. I have a real life case of an elderly man, not too old. I'm not going to tell anything more than that, who came and presented, to the clinic because of concerns as per erectile dysfunction. So from the history and some physical examination, the clue that we could be dealing with thyroid problem came up, and the man didn't even know what thyroid gland does. So when we did TSH, T3 and T4, lo and behold, it was hypothyroidism. And when it started the appropriate intervention, by the time we get to the treatment, we'll talk details of that. Now, it was better. So hypothyroidism could be responsible. Hypercortisolism, hypogonadism, hyperprolactinemia, hyperthyroidism, they could all be responsible for erectile dysfunction. Okay, that's what I have tagged as 14 P's of ED. That is 14 P's of erectile dysfunction. These will help the nursing students and medical students to be able to rattle these ones. You know all these 14 P's, then you'll be able to write your essay pretty fast. The first is psychogenic. Then P for partners, attitude, maybe like I've said, cheating, fighting, disharmony, and so on. P for Peyronie's disease. I'm not going to go to now affecting the organ, you know what I'm talking about. Then P for pain. Because, of course, if somebody is in pain, what are you talking about? All he will want to hear that time is analgesic, and not be interested in anything. Now, P for peripheral vascular disease. By the time we go into treatment, I'll be able to go into details of that more. P for pancreas. And somebody is asking, what is the business of pancreas with erectile dysfunction? Of course, diabetes mellitus. P for pharmacology, and that will lead us to drugs or medications. Then P, when you write depression, then you put the P in the middle, as uppercase. So depression, and the same will go for hypertension. Another P for paralysis, spinal cord injury, or past surgery. And of course, the 12th P will be about pituitary hormones, like hyperprolactinemia, hypothyroidism, or hypothyroidism. Another P will be post-radiation, particularly of the pelvic region in any man having prostatic carcinoma, or for any reason that will make radiotherapy to be directed at the perineal region. And the last P is personal decision. The man can choose to abstain and pretend, or be honest about it, or lie about it, that nothing is coming up. So with that, I've come to the end of this presentation. Like I said, it is very sensitive, and I've tried not to be too raw about it, but pass the message across. We're not done yet. The next presentation will be on the treatment of erectile dysfunction. I can't wait to get to that because I have a lot to tell you on how the man could be assisted to get out of this, and you have a better life and a better relationship. Thanks for listening to my presentations. Kindly subscribe to my channel, and with that, you'll be able to get my presentations immediately they are published. I appreciate it.